Good evening to everyone and welcome to today's wonderful evening with Dr. Murali Bharadwaj. The whole secret of becoming the topper in the NEETPG or FMGE or INICET. What is the secret, doctor? 22,000 PYQs. Every time we feel, okay, we will do the PYQs in the last moment, etc., blah, 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 blah. But we don't get time. So first thing you need to do is solve the 22,000 PYQs and know what examiner wants. That is the whole secret. You don't need any other coaching program. So I am your classmate, roommate, benchmate, tablemate to sit along with you. And don't solve the PYQs like MCQs with a long explanation, right? We are only learning to know what examiner frequently tests in the NEETPG exam. So that is the reason we converted every PYQ into a single liner, classified into which topic it belongs, and provided this entire 22,000 PYQs, 10,000 PYQs from the NEETPG past 10 years, 6,000 PYQs from the FMGE past 10 years, and 6,000 PYQs from the INICET AIMS past 10 years. So once we solve this, how much time we take? Around 200 hours. So in this 200 hours, once you have done this PYQs revision along with me as single liners, you know what examiner wants, and that is the beginning of you becoming the topper. So can the online students can punch? Is the voice loud and clear, doctor? Everybody, please punch. Is the voice loud and clear? So we are with the point number 351. Right? We are with the point 351. In the total 6,000 FMGE question bank. So, doctor, where is the thyroid isthmus? Thyroid isthmus is there at the level of, typically you should know, it is across the second to fourth tracheal rings. Second to fourth tracheal rings is what you have to remember. So, parathyroid glands are supplied by which blood vessel? It is the inferior thyroid artery. Parathyroids are supplied by inferior thyroid artery is the blood supply to the parathyroids. Some of you are going to be endocrine surgeons. You are going to do for a parathyroid adenoma with a primary hyperparathyroidism, for a patient parathyroidectomy. So you should know the blood supply. So parathyroids are supplied by inferior thyroid artery is what you need to remember. What type of bone is frontal bone? Frontal bone has a lot of air sinuses. That's the reason it is a pneumatic bone is what you need to remember. Now, where is the gustatory cortex is located? We all smell, right? So gustatory cortex is situated in the inferior parietal gyrus. So the various lobes of the brain, what is their function? You should know. All our social inhibition is because of the parietal lobe is what you need to remember. So doctor, that's the reason. Can the online students can punch? Is the voice loud and clear for all of you? Please punch. Is the voice loud and clear? So inferior parietal gyrus is the one where the gustatory cortex is typically located. Now, if you look at the brain, what are the various areas, doctor? You should know. So you have a central sulcus, right? So before that, you are having the pre-central sulcus is primary motor area. Post is primary sensory area. Then typically you have the Wernicke's area, which is typically located in the, where is Wernicke's area located? In the temporal. Then in the inferior frontal gyrus, you are having the motor area for the speech, which is called the Broca's area, is what you should remember. Then you are having here the secondary auditory area. In the occipital lobe, you are having the primary visual area, and here you are having the primary auditory area. You need to be very, very clear about. So now, if you look at the pathway, gustatory pathway, how do we smell is a very important question, right? Sorry, how do we taste? Gustatory pathway. So typically you have the glossopharyngeal nerve, which is bringing the taste sensation from the posterior 1/3 of the tongue. Whereas the anterior part of the tongue, anterior 2/3 of the tongue, the taste is brought by the facial nerve. So both of them will be traveling to medulla oblongata. From medulla oblongata, they will be reaching the thalamus. All sensory pathways, touch, pain, pressure, everything, all sensory pathways, olfactory pathway, except olfactory pathway, the gustatory pathway, the visual pathway, everything need to reach thalamus. From thalamus, it need to go. So that's the reason, remember, gustatory cortex is typically located in the insula, is what you have to ultimately remember. So the various lobes of the brain, the various pathways, and you should know everything when you go to the tomorrow's NEETPG exam, doctor. Now, if you look, as I told you, we have a thalamus. From the thalamus, it will go to the sensory cortex, right? Sensory cortex is postcentral gyrus, and motor is precentral gyrus, is what you need to remember. So that is the reason whenever you are getting temperature sensation, the temperature sensation immediately decussates at the level of the spinal cord. It won't wait until going up to the lower part of the medulla. So it will immediately decussate, goes up, and then from here it will reach the contralateral thalamus. From there it will be going to the sensory cortex, which is located in the postcentral gyrus, is what you need to ultimately remember. Similarly, if you look at the touch receptors are ipsilaterally traveling until the lower part of the medulla. There, they undergo a decussation to the opposite side and travel until thalamus. So, until thalamus, from this point of decussation, until thalamus, till this point of decussation. Can online students can punch? Is the voice loud and clear, doctor? Can the online students can punch? Is the voice loud and clear for all of you? One minute. Yeah, I hope the voice is loud and clear for all of you who are all online. Good. So you should know that the touch receptors are carried by the axons of the first order neurons, which are called fasciculus gracilis. So they reach, then from the lower limbs you get the fasciculus gracilis, and there is a fasciculus cuneatus, which is bringing the touch reception from the typically upper limb, and both of them reach the medulla oblongata. So there they undergo the decussation to contralateral side, and there the second order neurons are being carried, which is called medial lemniscus pathway, and from there it will be going to the third order neurons from the thalamus, it will go to the sensory cortex. So remember what is meant by lemniscus. Lemniscus is that tract which is carrying the second order neurons is called as lemniscus, is what you have to basically remember. So doctor, so that is the story. Orbit floor is contributed by which bone? You need to know it is the maxillary bone that makes the maximum contribution to the floor of the orbit, is what you have to remember. Similarly, cavernous sinus. Cavernous sinus receives, let me quickly check, is the voice loud and clear? Is the voice loud and clear, doctor? Yeah, I hope so. Good. Angular vein infection. So you should know, typically causes thrombosis in the cavernous sinus, has a relationship with the angular vein, is what you need to remember. Now, spinal lemniscus. Lemniscus carries second order neurons. It typically on the left side lemniscus will carry the right sided pain, touch and temperature fibers, is what you need to remember. Spinal lemniscus, right? Now, trochlea. So what is the function of trochlea? Trochlear nerve. Trochlear nerve typically helps in looking laterally and downward, So all the nerves which are causing the extraocular movements, you need to know very well, right? And function of each of them, what is primary deviation, secondary deviation, everything you need to know in ophthalmology. So what is the function of the trochlear nerve, doctor? Trochlear nerve helps to look outward and downward, is what you need to ultimately remember. Very good to see. 10 online classmates, can you please punch as a voice loud and clear for all of you, doctor? Right? Now, if you look at the cerebellum, there are various fibers in cerebellum. Every time examiner asks the questions. So you have a molecular layer, Purkinje layer in the cortex, then you have a granular layer. So what are the types of the cells you have in the granular layer? You have the granule cells, Golgi cells and mossy fibers. Then what are the various fibers which are there in the Purkinje layer? Purkinje cell and climbing fibers. Then in the molecular layer, what do you have? You have parallel fibers, basket cells, stellate cells. So parallel cell fibers, basket cells, stellate cells, Purkinje cells, climbing fibers, granule cell, Golgi cell, mossy fibers. What is the role of each of the cerebellar fibers and what is the histological composition of the cerebellum? One of the favorite questions of the examiner, doctor. Now, if you look at the cerebellar cortex, what does it contain? It contains Purkinje fibers. One of the types of the fibers is Purkinje fibers. Now, if you look at the cerebellum, to all the other parts of the brain, how does the cerebellum project? Cerebellum typically projects to all the other parts of the brain with the help of the Purkinje fibers, is what you need to ultimately remember. Now, what is the level at which the adult spinal cord will end and infant's spinal cord will end? Two important anatomical levels that you need to be very sure about. In adults, the spinal cord normally ended at the lower border of the L1. Lower border of the L1 is what you have to remember. If you look at the infant, in contrast, the spinal cord ends at the level of the L3. Second important point that you need to basically remember. So like this, doctor, slowly, every day around 200 facts, 200 facts. In about 100 days, you finish 22,000 facts. The moment you finish 22,000 PYQs, ekdam revision. When you are studying, you know what to focus, what to ignore, what to memorize, what to have active recall and repetition. That is most important secret to become the winner in the tomorrow's NEETPG exam. Right, doctor? Now, fasciculus gracilis. I told you, no? Fasciculus gracilis brings the dorsal column fibers carrying the touch sensation from the lower limb. Fasciculus cuneatus brings the fibers from the upper limb, is what you need to ultimately remember for the tomorrow's exam. So it is the posterior column of the spinal cord. Of all the spinous processes in the vertebrae, it is the C7. C7 has the most prominent spinous process, is what you have to remember. Now, whenever you are saying no, which joint is moving, doctor? Atlantoaxial joint is the one which will make you to do the no movement, is what you need to remember. So please see, we have a articular process. There is a place called carotid tubercle. Carotid tubercle, right? So this is the inferior and superior articular process of the vertebra. So you should know Chasinex tubercle is the carotid tubercle which is there in the which vertebra? C6 vertebra is what examiner is going to ask in the tomorrow's NEETPG exam, doctor. C6 vertebra. Now, prostate gland. What is it made up of? It is composed of the glandular tissue and the fibromuscular stroma. Glandular tissue and fibromuscular stroma. Once more, prostate gland. What are the lobes of the prostate gland? From where does the cancer arise? From where does the BPH arise? Everything you should know, doctor, right? So, one of the favorite areas of the examiner. So, what is the normal weight of the uterus? Uterus normally in a non-gravid, non-pregnant women is 60 grams is what you need to remember. Now, doctor, if you look at the various muscles of the vocal cord, right? So, it is the sixth branchial arch which gives rise to the various muscles of the vocal cord is what you need to remember. Now, seminal vesicles. Typically, seminal vesicles depend on testosterone secretion, and typically the seminal vesicle fluid contains fructose. And what is the epithelium of the seminal vesicles, doctor? Pseudo-stratified columnar epithelium is the epithelium of the seminal vesicles, is what you have to remember. Now, doctor, if you look at the carpal tunnel, you should know anything about the carpal tunnel, right? So what is this called as? This is the dorsal carpal ligament. Then you have the hamate, capitate. So what do you have? Hamate, capitate, trapezium, trapezoid, right? Try to catch her. Try to catch her. She looks too pretty. Try to catch her. She looks too pretty. Right? So, she is scaphoid. Looks is lunate. Pretty is speciform. Try to catch her. So, you have the trapezium, trapezoid, capitate, and hamate. So, here you have the flexor digitorum profundus, and this is the flexor digitorum superficialis, and this is the flexor pollicis longus. Pollex means thumb. And you have the flexor carpi radialis. So this is the typical structure which you need to remember. So if you look at the flexor retinaculum, the various structures which are passing, you have the extensor pollicis longus, then extensor digitorum, then here you have the hypothenar eminence. You can see the hypothenar eminence, hamate, capitate, trapezoid, trapezium. Here you have the abductor pollicis longus, extensor pollicis brevis, the two muscles, and here passes the radial artery and radial nerve, and here you have the extensor carpi radialis longus and brevis, extensor pollicis longus in one single compartment you can see, and here you have the palmar branch of the median nerve which is passing, and typically this is the one which is vulnerable for the compression in the carpal tunnel when it is passing, is what you have to basically remember. So now, doctor, this is one more view you can see. The flexor carpi radialis has got its own separate compartment. That's one of the another favorite questions of the examiner, right? It has its own separate compartment. Here you have the ulnar artery and ulnar nerve in this is called the canal of Guyon. Guyon's canal, closer to the hamate, right? And this is the typical flexor retinaculum. So here you have the scaphoid and trapezium. Here you have the hamate and pisiform, which are typically the attachments to which this flexor retinaculum is forming, is what you have to ultimately remember. So here passes the median nerve, which is vulnerable to the compression, is what you have to remember. So now, flexor retinaculum, typically, what are all the various muscles that pass underneath the flexor retinaculum, doctor? Just before you have seen flexor pollicis longus for the thumb, flexor digitorum superficialis and flexor digitorum profundus will pass underneath the flexor retinaculum, is what you have to ultimately remember. Right, doctor? Now, trapezius. Can the online students can punch? Is the voice loud and clear for all of you, doctor? Trapezius, typically what are the attachments? So you should know the muscle trapezius, clavicle, scapule, occiput. To all these three, the muscle trapezium is attached, is what you have to ultimately remember. Now, whenever there is any ulnar nerve injury, there's a clawing of the medial 2 digits, adductor pollicis, pollex finger is there, no? Adductor pollicis, which lead to adduction, that is affected. Most of the pollex muscles are all supplied by median nerve. The only one which is supplied by the ulnar nerve is adductor pollicis, palsy will be there, weak grip will be there, is what you need to remember. Then how about the median nerve injury? Typically it leads to pronator quadratus, flexor pollicis longus, flexor carpi radialis. They're all supplied by the median nerve, is what you should remember. Now, what are the muscles that constitute the rotator cuff, doctor? SIT. S for supraspinatus, I for infraspinatus, T for teres minor, not teres major. Most of the times, this is one of the frequently asked question. Can the online students can punch is the voice loud and clear for all of you? Now, doctor, you can see this is the supraspinatus, this is subscapularis, and here you have the acromion, the clavicle, and here you have the teres minor, and this is the long head of the biceps tendon. So what constitutes the rotator cuff? Supraspinatus, infraspinatus, and teres minor. SITS is what you have to basically remember. Right, doctor? Good. Now, if you look at the axilla, what are the components of the posterior wall of the axilla? Teres major, subscapularis, latissimus dorsi. Teres major. Teres major. So what are the muscles that constitutes, doctor? Axilla's posterior wall. Once more, axilla's various walls, what muscles constitute each of the wall, medial wall, lateral wall, etc. You should know. So posterior wall of the axilla is teres major, subscapularis, and latissimus dorsi. The three muscles which you should not basically forget. Now, what are the contents of the cubital fossa? So you should know ulnar artery, median nerve, and brachial artery. They are the important contents. So typically, the cubital fossa also has the median nerve, biceps, which are forming the boundaries. So you should know. You have a superior border of the cubital fossa, superior border of the cubital fossa, which is formed by the line joining the two epicondyles. Then the lateral boundary is formed by the brachioradialis. And the medial border is formed by the pronata teres. And what are all the structures that are there on the medial side? Ulnar vein, ulnar artery, medial border is formed by pronata teres. Then you have the median nerve, right? Median nerve. Then here you have the brachial vein, the brachial artery, and here you have the biceps tendon, So the cubital fossa, what are the boundaries, what are the contents, how is the floor formed, what is the lateral border, medial border, and superior border. Every NEETPG exam you go, you need to be very clean and thorough in your concepts when you are going to face the examiner, doctor. Now, what is triangle of auscultation between the scapula, trapezius, and latissimus dorsi? So here you can see this is called the triangle of auscultation. So what do you have here? Below are the horizontal fibers of the latissimus dorsi. These are all latissimus dorsi muscle, right? Medially is the lateral border of the trapezius. So you can see this is the trapezius muscle. Medially, it is the lateral border of the trapezius. Laterally, it is the vertebral border of the scapula. Vertebral border of the scapula is what you have to basically remember. And the floor of the triangle of auscultation is 6th and 7th rib is what you have to ultimately remember. Now, femoral artery. What are the various branches of femoral artery? Superficial epigastric, superficial circumflex, and descending genicular branches are the branches of the femoral artery. Now, what is iliotibial band, doctor? Tensor fasciolate, gluteus maximus, they all take an origin, and vastus lateralis. So what is this, doctor? Gluteus maximus. Gluteus maximus. So you can see the typical tensor fasciolate, right? The tensor fasciolate, right? So the tensor fasciolate, gluteus maximus, and the vastus lateralis. So where do you have vastus lateralis? This and this is all vastus lateralis. They all typically have a insertion into the common iliotibial band is what you need to ultimately remember. Now comes the sciatic foramen. One of the favorite questions of the examiner. Lesser sciatic foramen. You have pudendal nerve, interpudendal vessels, right? Pudendal nerve, interpudendal vessels, right? Which are the part of the lesser sciatic foramen. Typically, obturator internus, they all will pass. So let us quickly get an idea what is a greater and lesser sciatic foramen, doctor. If you look at the pelvis, here you have the greater sciatic foramen. And what is this ligament called as? Here, the sacrotuberous ligament. And what is this ligament called as? This is called sacrospinous ligament because it is connecting with the ischial spine. This is sacrum, this is ischial spine. So sacrospinous ligament is what you need to remember. So now once more, if you look at, you can see here you have the lesser sciatic foramen. That is, here you have the greater sciatic foramen. And this is the sacrospinous ligament and sacrotuberous ligament is what you need to understand. So once you know that, you know most of the other things. If you look at the typical pelvis, here you have a very important muscle. This is called the piriformis. Above the piriformis, suprapiriform foramen. Below the piriformis, you have the infrapiriform foramen. All right, doctor? And this entire whole is called greater sciatic foramen. Then here what do you have? Lesser sciatic foramen. Lesser sciatic foramen here. This is lesser sciatic. So the greater sciatic foramen in turn is divided by the piriformis into two compartments, supra and infrapiriform foramen. So suprapiriform foramen, it contains superior gluteal artery and vein and superior gluteal nerve are the components. If you look at the infrapiriform foramen, you have the inferior gluteal artery and vein, inferior gluteal nerve, sciatic nerve, posterior femoral cutaneous nerve, internal pudendal artery and vein, and the pudendal nerve. They're all the components of the infrapiriform fossa. All right. Then, if you look at the lesser sciatic foramen, what are the components of the lesser sciatic foramen? Internal pudendal artery and vein, pudendal nerve, tendon of the obturator internus, they are the components of the structures which are passing through the lesser sciatic foramen is what you have to ultimately remember. So, doctor, lateral cutaneous nerve of thigh, it arises from the L2 and L3. It is purely sensory, and any injury lead to a burning sensation along the lateral aspect of the thigh in a very obese woman, which is called meralgia paresthetica, is what you should remember. Now coming to the right coronary. So coronary arteries, what do they supply? Favorite area of the examiner. Right coronary artery supplies right atrium, posterior aspect of the interventricular septum, and SCA node, which is the pacemaker of the heart, is also supplied by the right coronary artery. So whenever right coronary artery occlusion is there, SCA node get affected, and that lead to the development of the the slowing down of the heart. Right, doctor? Then right heart border, left heart border. If you look at the heart is typically having a right heart border and left heart border. So the right heart border, if you take from the above, superior vena cava, below is the inferior vena cava. Then right atrium. These are the three structures that form. Always remember, right atrium is more anterior, left atrium is more posterior. Right ventricle is more anterior, left ventricle is more posterior. Right ventricle is immediately below the sternum. That's the reason any injury of the steering wheel typically pushes the sternum onto the heart, and right ventricle is most damaged in the steering wheel injuries is what you need to ultimately remember. Now, if you look at the left adrenal gland, so what are the relations of it? Left adrenal gland posteriorly is related to psoas major. Left adrenal gland spleen is anterolateral. Left kidney obviously is inferior to suprarenal gland, that is adrenal gland. So you should know the various boundaries. Then coming to aortic opening in the diaphragm. What does it carry? Aorta, esophagus vein, thoracic duct, they all pass through the aortic opening. Aortic opening, right? So aorta, esophagus vein, and thoracic duct, they all pass through aortic opening is what you need to basically remember. So what does esophageal opening contain? Esophagus, vagus, and gastric arteries branches, they all pass through the esophageal opening. So what are the various vessels which are called the vessels which are valvulous? Superior vena cava, pulmonary vein, internal jugular vein, portal vein, they're all the examples of the valvulous vessels is what you have to understand. Now, what are the various arteries which are the examples of muscular arteries? You have elastic arteries, muscular arteries. So, femoral artery, popliteal artery, splenic artery, they're all basically muscular is what you have to ultimately remember. Good to see 5 online classmates. So, every day I come online, every day we discuss the PYQs, and also we have a video library already covering all the contents of the subject. So this entire thing is made available in the video library. So please do come every day. We will have a live discussion. We will inspire you to study every day, Monday to Thursday. Friday, Saturday, we have a subject-wise mock test and discussion. Sunday, full-scale mock test and discussion is what you have to remember. Now, what are the relationships of the spleen? The fundus of the stomach. Spleen. Spleen is on the left side. Stomach is also towards the left. So, fundus of the stomach, left kidney, the splenic vessels, the splenic flexure of the colon, they're all. So, this is what Dr. Splenic flexure of the colon. So, this is the spleen. You can see the tail of pancreas is in relationship. All right. So, if you look, the spleen, the various relationships of the spleen, you should know anteriorly it is called the visceral surface of the spleen. Visceral surface anteriorly. Stomach, tail of pancreas, left colonic flexure and left kidney. You can see tail of pancreas, right? Then splenic flexure of the colon, left kidney. So posteriorly what do you have behind the kidney? Tick, 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 kidney, spleen ke piche kya hai? Diaphragm. And this separates it from the left pleura. Similarly, the left lung, the 9th and 10th and 11th ribs, they're all the important posterior relationship is what you need to remember. And inferior to the spleen, what do you have? Left colonic flexure is inferior to the spleen. And medially, what do you have to the spleen? Left kidney is medial to the spleen is what you need to ultimately remember. So, doctor, with this we will conclude the today's wonderful evening. Rose milenge, rose padenge, and we finish 22,000 PYQs within 200 hours of discussion together live every day on the YouTube. Good night and enjoy the preparation.